So first, I want to talk just a little bit about tobacco addiction, which is one of the interesting phenomena in terms of substance abuse globally in the world today. This is from a 2022 survey that was taken, the Global Adult Tobacco Survey in South Africa, which showed that actually 25.8% of South Africans smoke tobacco. That's actually a very high, it's a quarter of people. 41% of men and 11.5% of women. And we're very aware, we've got very good understanding of all the chemicals. There's more than 7,000 chemicals. Many of them are harmful. 69 has actually been identified as definitely being carcinogenic. And it's also inexpensive. So it's something that patients spend a lot of money, or people spend a lot of money on. So I think you can get a really cheap packet of cigarettes if you know where to buy for about 30 Rand a day, but quite a lot of the smarter products will be considerably more depending on what you're buying. And when we look at studies where they've looked at various interventions to help people quit smoking, or sort of how people, how many people actually quit smoking, quit rates that's sustainable rarely exceeds 25%. So these are people who actually try to stop smoking, and most of them are actually not successful. So tobacco smoking is interesting because it's probably, of all the substance abuses, the greatest con. And it's sometimes useful I find it very useful when I speak to adolescents, because smoking has no benefit to the user whatsoever. So when somebody has their first cigarette, you might have a slight little head rush from your first nicotine, but your nicotine receptors adapt very quickly. And by the time you've had your third cigarette, you're no longer going to have any psychological experience of having that cigarette. What the nicotine in the end provides is, its only function is to actually then prevent withdrawal. So if you do smoke regularly and you become physically addicted, then when you are not smoking, that feeling is very unpleasant. It's a bit like having a very full bladder. And then when you have that cigarette, you have that experience of relief. So when people talk about cigarettes relax them, or they find cigarettes makes them feel good, actually that is the fix for their withdrawal that's creating that experience. Nicotine in itself doesn't make you high, for example, like marijuana, or doesn't have some of the psychological effects of alcohol. So what the tobacco companies do is they target the youth. So 80% of people who start smoking is going to start before the age of 21. It's quite uncommon for somebody in their late 20s to go, oh, I think I'll take up smoking or vaping at this age. And so the tobacco companies make it this, creates all kinds of sort of marketing around getting young people to start smoking. And once you are hooked, as we've seen, quit rates are very low. Now you've got a customer for life who's going to spend, if they're on a 20 cigarettes a day, they're going to spend 1,000 Rand a month to make sure that they don't withdraw. And I still find it amazing that they're allowed to do this. So we're all very aware of all the things that tobacco does. This is from the WHO data, looking at, and that 5,395 deaths that is mentioned there is millions of deaths. This is some data from 2005. But what's interesting here is they show that it's a risk factor. If you look at 8 of the leading causes of death in the world, tobacco is a significant risk factor for 6 of those. So that includes ischemic heart disease, cerebrovascular disease, lower respiratory tract infections, COPD, obviously, tuberculosis, tracheobronchus, and lung cancers. All of these things are made worse or potentially even precipitated by smoking. So the health effects, in terms of if we start looking from a public health point of view, are enormous for something that has no benefit whatsoever. So the barriers to stopping and making it difficult to quit, we can look at 3 different aspects, and we need to consider this when we're trying to help people to quit. So there's the physical addiction side. I'll go through each of these in a little bit more detail. There's the psychosocial, emotional reasons why people smoke, and then there's the behavioral, social aspects of it. And our physical addiction is very much driven by very specific neuroreceptors. So there's a dopamine reward when you're having your fix from your withdrawal, but also you actually create an increased number of nicotine receptors gets created in the brain when you are smoking, and when you don't smoke and those receptors are not being activated, that causes the symptoms of withdrawal. So there's various stages of nicotine withdrawal. So if you stop having a cigarette, already within 24 to 48 hours, most of the nicotine will actually wash out of your system, so you won't have any more nicotine in your body. And then you will have these various potential symptoms. So that includes headaches, coughing, A problem is always if it increases appetite and people might gain weight, might cause us mood changes, sadness, irritability, frustration, anger. People might feel very restless. There's actually been some people actually have a decreased heart rate and can feel quite fatigued with that. Can cause difficulty in concentrating, sort of influenza flu-like symptoms and insomnia. All of these are very mild. So, for example, most people who are going through withdrawal, except of course with the insomnia a little bit, can actually sleep through it. So you have a very unpleasant day, and when you go to bed, you can actually sleep. So it's not that severe, but because it is very unpleasant, it's quite difficult to just not give in to that cigarette for the few weeks it's going to take for your body to readjust. So your nicotine levels actually drop dramatically already within 1 or 2 hours. So most people will start feeling some of these symptoms within 2 to 4 hours after their last cigarette, which is sort of roughly when you start craving your next cigarette to take those symptoms away. If you don't have a cigarette, peak withdrawal is by day 3. So those first 3 days are very, very unpleasant. And after day 3, at least some of your energy levels are returning. And then you might have some odd low-grade symptoms that can take 2 weeks, as little as 2 weeks, some people right up to 4 weeks to completely settle down. So from a physical point of view, this is not actually, in comparison with some of the other substances, it's not dangerous to your health to withdraw. It's also not severe withdrawal symptoms, but it's unpleasant enough that most people don't manage to stick it out. There's also emotional, psychological reasons why people like to pick up substances. And it has a little bit to do with the way different people manage anxiety and distress. So none of us like having anxious feelings. It's unpleasant when you're feeling anxious or distressed about something. And we all have little techniques on how we deal with anxiety. And for some people, actually distracting themselves from what is happening by doing something else actually helps to reduce that feeling of anxiety. So, and this could be any activity, whether it's binge watching Netflix, or whether it's alcohol, or whether it's cigarettes. It's something that you use because it distracts you temporarily from whatever is making you feel anxious. There's different reasons why people might have that as a tool. Sometimes it's just your personality. It's the kind of way you cope with anxiety. People with ADHD might have that as a major way of how they deal with things that they can't manage. They distract themselves with something else. You might have a very high sensitivity. We also see that within some of our neurodivergent people and people with mental health issues. But it might also just be something you've picked up because that's the way we do it in my family, or that's the way my friends do it. So if we're stressed and we all go around the back of the school and we all have a ciggy together, that might feel like a way that we are managing with what's happening in the classroom. And so what happens is this is just a little methodology that we're using to manage our stress, but it can now become an habitual coping mechanism whenever we feel distressing emotions. And that's important because once somebody's through the physical addiction, they need to find another way to deal with their anxiety and stress rather than reaching for a cigarette. So this emotional crutch can then become a bad habit. And so what happens is in the beginning, it might be something you do because that's what your buddies do. But eventually it becomes something that you've built into your day as part of your sort of withdrawal thing. So first thing in the morning, you have your cup of coffee and you have your cigarette. Whenever you have a break, you start relating cigarettes to breaks. So when you have a break at work, you pop outside, you have 5 minutes to quickly relax and you have a ciggy. When you get home from work and you sit on the couch while you're scrolling through your social media, it might become a habit whenever you're out at a restaurant or a bar or a club, or when you are socializing with other people that are also smokers. So when we're talking to our patient, we need to start understanding where cigarettes has become part of their habitual life, because we need to think about that if we actually want to bring in different habits. That's not going to trigger this need to have a cigarette. So how can we help people quit? And firstly, I'm going to be looking at some of our nicotine replacement products, and then we'll look at some of the behavioral interventions. So nicotine replacement therapy has been around for quite some time, and there's actually a lot of studies